As for Florida, the plans network and prices, we have our plan suite, which I think many of you are already familiar with it. We have the Simple Saver, which is designed for those looking to save money on their healthcare coverage. These plans are what I like to call the just in case. Members just want to have a plan for just in case. They want to know how much they're going to be paying out of pocket in case of an emergency. And so they just want to have those just in case plans. The classics are a little different. They are designed for those who are not regular utilizers, but want to have predictable co-pays for most of their common services, say PCP, a specialist, the generic prescription medication, etc. And then we have what we call the elite plans. These plans are designed for those who regularly utilize their health insurance or take medications and want predictable co-payments. So as we transition from an EPO to an HMO, we have here what is going to be the accessible gold options. And I want to walk you through this scenario as we go from all of our Florida members going from an EPO to a non-gated HMO. We want to push for the gold simple, and I'll explain to you why. Reminder that there's no referrals required. Okay, so what you have in front of you right now is a 2025 Silver Simple PCP Saver. Okay, this individual is on the 150% FPL, so they're on the lower scale. This person has enhanced subsidies this year. So as you can see, their premium is very low. In many cases, their premiums are $0. This person has a deductible of $0, a max out of pocket of $1,650, a PCP of $5, and a 30-day generic prescription at $0. What's going to happen to this exact plan this year for 2026 is going to be to your right. This is the exact same plan, except that there is no longer enhanced subsidies, okay? This individual is going from $0 deductible to a $7,000 deductible, an out-of-pocket max of $1,600 to a $10,000 out-of-pocket max. Now, I know these numbers are scaring you, but I want to remind you that this is going to happen across the board. Every single carrier this year for 2026, their out-of-pocket max will increment. So this person went from paying a $5 PCP visit to now a $40 PCP visit. So what Oscar is going to introduce to you now is for you not to choose the buy down to a bronze, because usually when you quote a member and their silver option is very high, what agents and members tend to do is that they tend to look for the second option as a bronze play. So I'm going to show you here what a bronze elite looks like. Sure, this member will likely pay $0 for their premium to very low cost of a bronze. However, you're looking at their max out of pocket being $10,600, their PCP being still a little higher than the silver, and the 30-day generic prescription remains at $3. Instead of looking for a bronze play, I want you to buy up to a gold. Why am I pushing you to buy up to a gold? Well, number one, we're talking about members that have been utilizing their coverage for the past couple of years at a very low cost. These members have been paying from $0 to $5 for their PCP visits, for their prescriptions. They've been paying for their specialists, very, very low cost co-payments, right? Because we're going to talk back to the suites where the simples have predictable co-payments. So the gold is going to have a deductible of $3,500. However, that same medical deductible is the same deductible for their medication. So it's the same deductible. The RX and the medical deductible is all in one, which is not the cost for the bronze elite. The max out of pocket is a little lower, but as you can see, the PCP is down to $10. In many cases, which I'll show you in a little bit, you're going to see that the gold simple is also going to be $0 in a lot of areas in Florida. So the best option here for this specific member who's coming from a silver simple PCP saver is to buy up to a gold simple, because essentially they're actually saving money by buying up instead of buying down to a bronze. So moving over to condition-based plans, We have seen proven results across our condition-based portfolios. We have what's called the diabetes plans, we have the chronic condition care plans, and as we're introducing the new menopause plans. These plans have increased 15% of PCP access for our members, 13% increase in clinically relevant exams, meaning that these members are actually getting their lab works done. And there's a lower ER and urgent care utilization, meaning the members are actually visiting their PCP, their specialist, versus waiting for things to get a little too difficult or for them to have much higher increases of pain for them to just go to the ER and urgent care. And that also lowers their A1C levels. Many of them have better blood pressure controls, and there's a higher medication adherence for members on these condition-based plans. Why are we introducing the women's health menopause? Well, let's address unique needs. There's 75 million women which experience symptoms related to menopause in the US. We want to deliver comprehensive and age-appropriate care for these ladies. There's also proactive health focus. Many of these women begin to lose bone density, right? So their calcium is a lot lower, etc. So we want to offer overall well-being with regular screenings and preventative care at a much lower cost. This is going to access without barriers. This plan is designed to go beyond basic coverage for essential prescription and treatment plans. We're also introducing the Oscar Calm Health. All of our plans this year. I don't know if you're familiar with this. I myself am a member of the Calm app. I really love this because this really focuses on mental health, and we're going to have this available for all of our members at no cost starting January 1.